How much does Medicare cost? This is a fair question. It comes up quite often. It's a popular search term. And I actually did a video on this 3 years ago, and I decided it was time to update it. I have over 100 videos out there, and some of them are dated and they need to be refreshed. And this is one of them. So yeah, you can go back and compare if you want to. This is going to take a little bit different slant. So how much does Medicare cost? And we're going to talk about that in a minute. This is Bob Vineyard, your Medicare expert, with the Georgia Medicare Minute. All right, in order to, when you're ready to go on Medicare, you're going to have Medicare Part A and Part B. Those two complement each other. Medicare Part A is hospital inpatient coverage. Medicare Part B is for your health care outside of the hospital. That's things like doctor visits, labs, MRIs, CAT scans, emergency rooms, and so forth. Medicare Part A, typically no premium for most folks. You've paid into Medicare during your working life, and most of us have paid in enough. Some people feel like we paid more than our fair share, but we paid in enough that you get to 65 and Medicare says you don't have to pay your Part A premium. And that's kind of nice. Part B, on the other hand, now this is 2021. The standard premium for Medicare Part B is $148. Medicare Part B, again, it's for your outpatient health care coverage. You have to have both of them even before you can get a Medicare supplement plan. You can't have just one or the other. You have to have A and B before you get a supplement plan. How's a supplement plan work? Well, a supplement plan is also known as a Medigap plan. They're interchangeable terms, just like Kleenex and tissue. Supplement plans in Georgia, the most popular plan this year, 2021, and it's also been popular for half a dozen years or longer, is the G plan. Now, the G plan pays your hospital inpatient deductible. Medicare Part A does have a per admission deductible. You don't have to worry about that because the G plan pays it. Medicare, the G plan does not pay your Part B Medicare deductible. That is an outpatient deductible. Currently, 2021, it's $203 per year. It's a calendar year deductible. So you have to pay that after the deductible's been satisfied for your outpatient care. Medicare pays 80%, the G plan pays the other 20%. So you have a way of budgeting your health care cost. If you don't use your plan a lot, if you're generally in good health, well, congratulations. Yeah, you've paid premiums, but you may feel like you haven't gotten any benefit from it. And some people do feel that way, and they're certainly entitled to it. But I would be glad to introduce any of them to clients I have that have been using their plan judiciously, and they are coming out they are incurring bills month after month after month, big bills, but they're only paying their out-of-pocket cost for their health care because they have a G plan is about $200 a year. So those folks would much rather have their health than feel like I'm paying for this for nothing. Your health is worth something. There is a cost to that. And but the Medicare G plan does save you money. Medicare, as far as your out-of-pocket costs, when it comes to it saves you money. It also makes it easier to budget. You're budgeting for a monthly premium as opposed to trying to figure out, well, how much I'm going to pay for health care this year, how much I'm going to pay next year. And again, a lot of folks do look at this as if, well, I've never paid that much. I have never been in the hospital. I've never really been sick, and why should I worry about it now? Well, because for a lot of us, once we turn 65, it seems like our body just kind of breaks breaks down, falls apart. My wife is like that. She's been pretty healthy, but once she retired, then all of a sudden it seemed like everything went wrong. Nothing serious, but she's just had a lot of situations, most of them related to older age. I'm older than her, so I can say that and get away with it. But how much does Medicare cost? Well, it depends on the route you want to take. And yeah, there are plans out there that do not charge a monthly premium. But if you get sick with one of those, you better have $3,000, $4,000, $5,000, $6,000 or more that you can put your hands on to cover your out-of-pocket cost. Plus, there's a lot of hassle in dealing with making sure that all of the doctors and the hospitals and so forth are in network. They accept this plan. And, because you really don't want to color outside the lines with one of those plans, because those no premium plans can end up costing you a lot of money. So how much does Medicare cost? A lot of it's up to you, the type of plan you pick, and how healthy you are. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.